My name is Phillip Singer. I'm an orthopedic surgeon here at WKONA. I've been here about 27 years. My typical patient is the adult patient with spine issues, and basically the adult degenerative condition. The majority of people that I see are not here with 2 days worth of back pain. That kind of thing is, generally speaking, taken care of with a variety of other healthcare providers around the area. Occasionally I will, but most of the people I see are people who have been chronic discomfort or severe discomfort that's not amenable to just basic conservative measures. Any adult that has a spine is going to have some form of deformity to it. The vagaries of spines as we age create all sorts of challenges for patients, and that's my job, is to help them sort through those challenges. You know, the biggest service I have to patients, and I think it should be true of any back guy, is not necessarily offer them fancy surgery, which we do, but that surgery is the last option we throw at people. The greatest service we can have to people is listen to their concerns, establish where we think their pain's coming from, and then once you do a decent job of talking to the patient and that sort of thing, then looking at reviewing their studies, making sure that their studies fit with what they're saying. It's not just simply, you got back pain, here's an MRI, let's respond to that MRI scan. Let's make it all make sense. And so I work very closely, for instance, with interventional pain specialists, interventional radiologists, physical therapists, even local chiropractors. All the tools that you have available to you to help work up and treat patients, we've got all that sort of stuff right here. But the biggest misconception about back pain that I see with a lot of patients is it's not necessarily curable. It's any treatment is bound to fail because they know someone who had an operation and they never walked out of the hospital or what have you. And the reality is your spine is a long piece of equipment on you. It goes from tailbone to brain, and there are a lot of different ways it can fall apart in different locations for different reasons. And that's another thing to keep in mind, is that you may have different things affecting you at different times in your life with the same spine. You know, I'm proud to say, and I've been in Bowling Green for a long time now. I think I can say for 27, 28 years practicing with basically the same group of guys all along. But what we are careful about doing when we add doctors to WKONA, we operate in an environment where we can look at each other's work. We see what the other guys are doing. And that kind of peer pressure matters. It truly does. And I can say unequivocally that if I had an orthopedic problem tomorrow, I wouldn't hesitate to have anybody in this room work on me. And that's really true of a lot of Bowling Green. I think the medical community in Bowling Green, Kentucky, is fantastic, and I'm always proud to say I operate in Bowling Green, Kentucky.